as the legislature monitors the progress or lack thereof regarding the EPA and inaction, we are preparing to compel action, at least outside Coakley, where we know there's ongoing contamination of pristine watershed. So I'm incredibly encouraged and very positively hopeful, since you have said that you are doing these studies to look towards a long-term remedy. So I will plan to hold you to that, and the EPA to that, because up till now many of the residents and much of the legislature has been frustrated by the lack of action. So I hope you will partner with us in compelling the action on Barry's Brook to make sure we protect not only its watershed, but Little Harbor, the Piscataqua, and the Atlantic Ocean. That is not, dilution is not an acceptable remedy when there's known surface water runoff in, at least in my committee as chair of Health and Human Services and as a member of the Cancer Cluster Commission. So I appreciate your saying that you're willing to move forward with action based on your bedrock studies.
Thank you.
Thank you. I just want to check on my assumption from what I heard tonight. The materials used for the cap for this landfill, there was no requirement by EPA or DES to test those materials. Am I correct in that?
There would have been, the design would have called for certain parameters to be tested for, and mostly would have been physical parameters, but there would have been chemical parameters too, such as volatile organic compounds and probably metals testing, but certainly no PFAS, because PFAS we weren't aware of, and 1,4-dioxane.
So somewhere those test results exist for the material that went into the Coakley landfill cap?
Yes, they should exist in a remedial action report.
Have any of those standards been revised since then for any new caps in New Hampshire subsequent to the Coakley capping?
No, I can't answer that question. I'm not aware of we have to follow up with you on a response to that with our landfill folks.
Thank you.
Are you asking if the cap itself may be contributing to the PFAS?
Yes, I am.
Just in case.
Thank you.
Mindy Mesmer again. So the question was mine about the health study that there's not been one done since 1992, an evaluation of the rates of chronic disease and cancer in the area of Coakley landfill. Many of us got involved in this because of a task force that was set up because we have a cancer cluster in this area. We also know we have very high rates of cancers in the state in general. So I was asking about whether or not there would be any plans to do another health study. There was a questionnaire that was done that was not followed on to. We have lost children in Northampton. We lost a boy. In Rye, we lost a boy. We also lost a man who was probably exposed in his youth to some of the Coakley landfill materials. We also know of 2 adult onset cases of RMS in the Merrimack area. Now, when you have adult onset cases, it tells you something because they're outliers, and the man who died also with contact to Coakley tells us something. So my concern is there doesn't seem to be anyone looking at whether or not, and I'm not saying there definitely is a tie, but at least we need to assess it. We need to look at the rates of cancer and chronic disease in this area and identify whether or not there are some contributing factors that maybe we are not aware of. Perhaps the PFAS levels are causing some of these illnesses. So that was my question. I'd like to raise it again. We don't get any answers about a follow-on to the questionnaire from the state of New Hampshire. We need to look at a little bit more in depth what is going on with regard to health with respect to the exposures of Coakley landfill.
Thanks. And for anyone that's not, aware, to be clear, we have been part of a commission that has looked at the cancer cluster, and most of you are well aware of that. You may also be well aware that the childhood cancer cluster has not been connected to any site in particular. There's a committee around the Coakley landfill, or around the cancer cluster, And it's been led by the New Hampshire Department of Department of Health and Human Services. And it's very difficult to ever make a defined connection between a health, and I'm not a health expert, I'm just speaking on behalf of EPA. It's very difficult to make that connection, and due respect, I appreciate you sharing that, but I don't like about tonight, which I think some of you understood and were receptive to, is part of that investigation. And there are national studies going on to look at PFAS and the health impacts of PFAS. And those are being done by health agencies who are the experts. So if you have questions about that, we'd be happy to try and put you in touch with the right people. But the impression that we're not paying attention to it and giving it the attention it deserves, I don't feel is accurate to share tonight. And I hope that everyone can appreciate where we're coming from and that we do care about this community. We're here tonight to share with you all that we're doing to try and define the contaminants that we're looking at here. So I just want to make that very clear. If anybody has any other questions about the presentations tonight or follow-up questions?
Yeah.
Sure.
Yeah, my name's Mike Yeager. It's the sense of urgency, or the lack of sense of urgency, I think, that bugs a bunch of us. Still don't see it. You say there's a lot's being done, but then we'll probably see in another year or so, and you'll come back. You're doing some studies every 6 months. My goodness, it just doesn't seem like you're really trying to get something done, actually physically done.
Let me take offense to it.
Well, I'll take those as comments. It's a good thing to. Are there any other questions?
Yeah, I just want to say one thing. I was not raising alarm. I was just asking a question because no one has evaluated
Sure,
the rates of chronic disease and cancer in this area at all. Even though we've asked, even though we had a questionnaire that went out that we failed, we don't feel was effective in looking at the rates of cancer. So that is not meant to alarm people. It is information, and I don't appreciate people calling it an alarmist.
It's fact.
It's facts that we need to collect and understand.
My kid is one of them that died, and we know that it's coming. PFAS is coming, and it's all through the United States, and it is coming, and it's not an alarm.
And I'm not trying to belittle
There are
that by any means. I'm
studies
just.
at St. Jude's on the commercials, on TV, specifically speaking to rhabdomyosarcoma. I don't know if you're missing these commercials or not, but they're already speaking to rhabdomyosarcoma at St. Jude's Hospital.
Sure, I'm certainly not trying to minimize any of that. I'm
Ooh,
just
I
trying
think you are.
I'm just trying to make clear that we're here, we're trying to explain to you what we're doing.
5 years I've watched this. 5. It's enough. Get moving.
All right, thank you for the input. We're just trying to share the information we have on the Coakley site here.